What if your feet have been trying to warn you about something serious, and every single day, you've been walking right past the signs? Right now, before any doctor's visit, before any blood test, before any diagnosis, the evidence may already be written on your feet. And what I'm about to show you today could genuinely save your life, or the life of someone you love. Here's what most people believe. They believe diabetes is something a doctor discovers. You go in for a checkup, the lab results come back, and that's when you find out. And I completely understand why people think that. For most of my career, that's what patients told me too. I had no idea, doctor. Nothing felt wrong. My name is Dr. Richard Ben, and I've spent more than 22 years in internal medicine. And the one thing I've seen confirmed over and over again, your body begins warning you about high blood sugar long before any blood test picks it up. And the very first place your body sends those warnings? Your feet. I'm making this video today because of the patients who come into my office, and worse, the ones rushed into emergency rooms, who had every single warning sign staring them in the face for months, sometimes years, and simply didn't know what they were looking at. Today, I'm going to change that for you. Just a few weeks ago, I saw a 71-year-old woman in my office, retired school teacher, active, sharp, felt fine. She came in for a routine visit. Before we even discussed blood work, I asked her about her feet. She said, "They tingle sometimes in the evenings. I just figured it was because I'm on my feet all day." She had 5 of the 9 signs I'm going to walk you through right now. Her fasting blood glucose came back at 228. She had been diabetic for at least 2 years. Nobody had caught it because nobody had looked at her feet. So today I want to show you exactly what I showed her. 9 signs that were already there on her feet and that are on millions of feet right now that almost no one recognizes for what they truly are. For every single sign, I'll tell you 3 things: what most people assume it is, what is actually happening inside the body, and one simple daily habit that can help protect you. The American Diabetes Association estimates that roughly 1 in 5 people living with diabetes in this country have no idea they have it. That's more than 8 million Americans walking around with a silent condition, quietly destroying their nerves, their kidneys, their eyes, and their circulation, all starting from the feet up. The good news is, a blood glucose test costs about $12 at any certified lab, and it's covered under Medicare. But before you can act on that, you need to know what to look for. So let's get into it. And this is the one I hear explained away more than any other. I have yet to sit across from a patient who hasn't already found a perfectly reasonable excuse for it. Tingling, numbness, that strange pins and needles feeling in the feet, especially in the toes, the soles, and around the heel. Patients tell me all the time, "Dr. Richard Ben, my feet fall asleep when I sit too long. It's nothing." And you know what? Sometimes they're right. If you cross your legs for 20 minutes and your foot tingles, that's circulation being momentarily compressed. That's normal. That happens to everyone. But here's the question I always ask. Is this happening regularly, without any obvious reason? Is it happening while you're lying still in bed? Is it waking you up at night? Because if the answer is yes, that changes everything. Recurring unexplained tingling or numbness in the feet is medically called peripheral neuropathy, and it is one of the earliest and most consistent signs that blood sugar has been running high for an extended period of time. Here's what's happening inside your body. Excess glucose in the bloodstream acts like a slow corrosive agent on the outer protective sheath of your nerve fibers. Over months and years, that sheath breaks down. The nerves become less reliable at sending clear signals. I explain it to my patients this way. Picture your nerves as fiber optic cables running from your brain to your foot. Those cables have a protective sleeve that keeps the signal clean and fast. When blood sugar is chronically elevated, it's like leaving those cables soaking in a mild acid. The sleeve slowly degrades. The signal starts breaking up. And that breakdown is what you feel as tingling or numbness. According to the American Diabetes Association, peripheral neuropathy is the most common complication of diabetes, affecting nearly half of all people diagnosed with the condition. And almost universally, it begins in the feet first. That means tens of millions of Americans are experiencing this right now and blaming it on their shoes, their age, or the way they slept. My recommendation? A 20 to 30-minute walk every single day. Not a run, a walk. Sustained, steady movement keeps blood pumping into the fine vessels that feed your nerve endings. Pair that with an immediate reduction in added sugars and refined carbohydrates. Not gradually, starting today. This one is particularly cruel, and my patients describe it as one of the most distressing things on this list, because it doesn't hit them during the daytime when they're busy and distracted. It waits until they're in bed, trying to rest, and then it starts. Many patients chalk it up to standing too long, wearing the wrong shoes, or just getting older. And sometimes that's genuinely what it is. But when a patient tells me their feet feel like they're burning, particularly at night, particularly when they're lying completely still with nothing touching their feet, I take that very seriously. A burning sensation in the soles of the feet at night is one of the earliest recognized symptoms of diabetic nerve damage. What's actually happening is this. The nerve fibers in your feet have been disrupted by excess blood sugar, and now they're sending incorrect signals to your brain. Your brain receives a message that says heat, even though no external heat source is anywhere near your foot. The nerves are misfiring. I use this comparison with patients who need a clear picture. Imagine a smoke detector with a damaged sensor. The room isn't on fire, there's no smoke, but the alarm is screaming anyway because the internal mechanism is broken. Your nervous system is doing the same thing. The burning sensation you feel isn't coming from outside your body. It's coming from damaged nerve tissue sending false alarms to your brain. Research published in the journal Diabetes Care identified burning foot pain as one of the earliest self-reported symptoms in patients who were later formally diagnosed with type 2 diabetes, in many cases appearing 1 to 3 years before the diagnosis was made. 2 habits I recommend here. First, 8 glasses of water every day. Proper hydration supports kidney function and helps your body manage glucose levels more efficiently, reducing further nerve stress. Second, add more fiber to every single meal. Vegetables, legumes, beans, oats. Dietary fiber slows the rate at which sugar enters your bloodstream, and those struggling nerve fibers need that buffer. Now I need you to pay very close attention here, because we're moving past discomfort and into the territory that sends patients to emergency rooms. This is the sign I dread the most when I see it late. Patients come in and say, "Dr. Richard Ben, I got a little blister from my shoe about 3 weeks ago. It's still not healed." They assumed it would close on its own. Most small wounds do, but not when blood sugar is high. When blood glucose is chronically elevated, your body's healing machinery begins to break down. The small blood vessels throughout your body, and especially in your feet, begin to narrow and stiffen. That means the oxygen, the immune cells, and the nutrients your body needs to repair tissue can no longer reach the wound effectively. Think of trying to deliver emergency supplies to a flooded town, but every road leading in is blocked. The resources exist, the trucks are loaded, but nothing is getting through. That's what high blood sugar does to your feet. The healing agents are present in your blood. They simply cannot reach where they're needed. And an open wound that won't close becomes an invitation for infection. In a foot with already compromised circulation, that infection can turn catastrophic with frightening speed. The Centers for Disease Control reports that diabetic foot ulcers are responsible for the majority of non-traumatic lower limb amputations performed in the United States, over 100,000 every year. And nearly every single one of those cases began with a small, ignored wound. Tonight, after your bath or shower, sit down with good light and look carefully at both feet. Check between every toe. Look at your heels. Examine the soles. If you find any cut, blister, or area of broken skin, clean it gently with mild soap and water, apply an antiseptic, and cover it. And if it is not visibly improved within 48 hours, call your doctor. Not next week, 48 hours. This one is hiding in plain sight. It's been visible every time a patient takes off their socks, and almost no one connects it to blood sugar. Patients notice their lower legs or ankles looking darker, sometimes reddish, sometimes with a faint bluish or purplish tint, and they tell me it's sun damage, or they say they've always had darker skin there, and that may be true. But there is a very specific pattern of discoloration around the ankles and lower legs that I look for as a direct indicator of blood sugar risk. And it looks different from sun damage. It looks like the skin is slowly being starved. Here's what's actually happening. When circulation in the legs is compromised by high blood sugar, the skin in those areas stops receiving enough fresh, oxygen-rich blood. The color changes. You may see darkening, a deep reddish tone, or even a bluish tint settling around the ankles. In some patients, the skin in those areas also becomes thinner and more fragile over time, another sign that the underlying tissue is not being properly nourished. I describe it to patients this way. Imagine your blood supply as a postal delivery system. Your feet are at the absolute end of the longest delivery route in your entire body, further from your heart than anything else. When the roads narrow because of blood vessel damage, deliveries stop arriving on time. The skin at the end of that route starts to show the effects of chronic underdelivery. The color change is a distress signal, visible to anyone who knows what to look for. A study in the Journal of the American Academy of Dermatology found that these specific skin changes are detectable, on average, 18 months before a formal diabetes diagnosis is made. 18 months earlier, if someone is simply paying attention. Daily habit: 5 minutes of ankle circles, calf raises, and toe lifts every morning before you do anything else. Even that small amount of movement stimulates blood flow into the lower extremities. And if mobility is limited, elevating your feet slightly while sitting can make a meaningful difference throughout the day. This one surprises patients the most because it looks completely harmless. Most people have lived with it for years, and almost no one thinks to mention it to their doctor. Patients say, "Dr. Richard Ben, my heels crack every winter. It's just dry skin." And yes, seasonal heel cracking is extremely common. I hear that constantly. But when heels are cracking in summer, when no moisturizer seems to make any lasting difference no matter how faithfully it's applied, that is a completely different story. Diabetes affects what are called the autonomic nerves, the nerves responsible for automatic functions your body handles without any conscious effort. One of those functions is regulating moisture and perspiration in the skin. When these nerves are damaged by elevated blood sugar, the sweat glands in your feet stop doing their job properly. Your feet begin losing their natural moisture from the inside out. No amount of lotion applied to the surface will fix what's breaking down underneath. I explain it to patients like this. Think of healthy skin like a well-maintained wall. The mortar between the bricks keeps everything sealed and strong. When the autonomic nerves are damaged, it's like the mortar starts crumbling from the inside. Cracks form on the surface, and those cracks, in a foot with compromised circulation, are not just cosmetic. They are open entry points for bacteria. I've had patients come in with heel cracks so deep they were bleeding, telling me they'd been applying lotion every night for 2 years with absolutely no result. That's not a skin problem. That's a nerve problem masquerading as a skin problem. The American Podiatric Medical Association identifies persistent treatment-resistant heel cracking as a meaningful indicator of autonomic neuropathy in older adults, a condition directly associated with long-term elevated blood sugar. Autonomic neuropathy is not a nuisance. It is a signal that the nervous system is under serious, ongoing stress. Habit recommendation: moisturize both feet every single night before bed. A thick lotion or pure coconut oil applied thoroughly to the soles and heels, but critically, never apply moisturizer between your toes. Moisture trapped in that area creates the perfect environment for fungal infection. And drink 8 glasses of water daily. Hydration works from the inside out, and your skin needs it just as much as your cells do. I want to stop here for just a moment. We've been through 5 signs together, and I want to ask you something directly. Have you noticed any of these signs in yourself or in someone you love? A spouse, a parent, a close friend? If your answer is yes, even to just one of these, go to the comments right now and type yes. Just that word, in capital letters. That's all. I read every comment on this channel, every single one. If you have a question, ask it. If something I said concerns you, tell me. That's exactly why I built this community. Not to lecture, but to genuinely help. And if this video is useful to you, please hit the like button right now. It takes 1 second, and it tells the algorithm to show this to more people who are walking around right now with signs they don't recognize. All right, let's keep going. 4 more signs. These are the ones I most often see either missed entirely or misdiagnosed as something else. This one is more serious than most people realize, because it's not just a foot problem. It's a window into what's happening to your kidneys at the exact same time. Patients explain it away immediately. I sit at a desk all day. I was traveling. I've been standing a lot at work. And occasional, activity-related swelling? That is completely normal. I want to be very clear about that. If you've been on your feet all day and your ankles puff up slightly by evening, that by itself is not alarming. But if your feet and ankles are consistently swollen, if you're pulling off your socks at the end of the day and seeing deep, lasting indentations in your skin, that changes the picture entirely. High blood sugar damages the kidneys over time, and the kidneys are your body's master regulator of fluid balance. When kidney function is impaired by years of elevated glucose, your body loses its ability to manage excess fluid properly. That fluid gravitates to the lowest point in your body, your feet and ankles. This swelling is called edema, and it is a sign that your body's internal filtration system is under serious strain. Think of your kidneys as the water treatment plant for your entire body. Every drop of blood passes through them to be filtered and balanced. When elevated blood sugar clogs and damages those filters, the system backs up. Excess fluid has nowhere to go. Gravity does what gravity does, and it pools in your ankles. Press your finger firmly into the swollen area. If an indentation remains for a few seconds after you lift your finger, that's called pitting edema, and it is not something to dismiss. The National Kidney Foundation reports that diabetic kidney disease affects approximately 1 in 3 adults with diabetes, and lower extremity swelling is frequently the first outwardly visible sign that kidney function is being compromised. When you rest, elevate your feet above the level of your heart, even just a few inches propped on a pillow. This encourages fluid to drain back toward the center of your body. Also, reduce your sodium intake. Salt tells your body to retain water, which makes edema dramatically worse. Read the labels on canned and processed foods. The sodium content in many of them will genuinely surprise you. And if this swelling is new, worsening, or persistent, bring it to your doctor at your very next opportunity. This is the one I see misdiagnosed most frequently, especially in men. And by the time they understand what it actually is, they've typically been medicating around it and masking it for years. The story I hear almost word for word goes like this. I've been taking ibuprofen for the foot pain for a few months. I figured it was an old sports injury acting up, maybe the beginning of arthritis. And sometimes that's exactly right. I don't dismiss that, but sometimes the pain has a completely different origin, one that anti-inflammatory medication will never touch, because it isn't an inflammation problem at all. When nerves are damaged by chronic high blood sugar, they don't always go numb and quiet. In many cases, they do the opposite. They become hyperactive. Instead of going silent, they begin firing random, intense signals that your brain interprets as severe, acute pain. Patients describe it as stabbing, an electric shock, a hot needle driving through the foot. It comes on suddenly, often at night when there are no competing sensory signals to distract from it. I use this comparison. Think of a car alarm that was knocked out of calibration in a minor accident. Every few hours it starts blaring for no reason. Nobody is near the car. Nothing is threatening it. The alarm is just broken, and it screams anyway. That's a damaged nerve. It sends emergency pain signals to your brain when there is no actual emergency. The pain is completely real. It is not imagined. But its source is nerve dysfunction, not a joint, not a muscle, not an old injury. And ibuprofen does not repair a nerve. What it does is muffle the alarm while the nerve continues to deteriorate underneath. Research published in the New England Journal of Medicine found that painful diabetic neuropathy affects approximately 1 in 4 people with diabetes and is one of the conditions most frequently mistaken for arthritis, tendinitis, or ordinary age-related joint pain. Every morning before you get out of bed, spend 5 minutes doing gentle foot and ankle mobility work. Flex your feet, draw circles with your ankles, gently pull your toes back toward your shin. Get blood moving and nerve signals warming up before you put weight on your feet. And each evening before sleep, give your feet a gentle, slow 3-minute massage, circular strokes across the sole and up around the ankle. Your nerve tissue needs circulation and stimulation, not just rest. When I see this one in a patient, it tells me the situation has progressed beyond the early stages. The damage has been accumulating for some time, and every single time I bring it up, I hear the same response. "Oh, I've always had cold feet, doctor. That's just me." And I understand that. Cold feet are common. Cold feet are normal for a lot of people. My response isn't to dismiss that. It's to ask one specific follow-up question. Are your feet cold in July? Are they cold under 2 heavy blankets while the rest of your body is warm? Because that's when the conversation needs to shift. Feet that remain cold regardless of ambient temperature, cold in summer, cold in warm rooms, cold even when the rest of your body feels comfortable, are a strong sign of significantly impaired blood circulation in the lower extremities. Your blood vessels have narrowed or stiffened to the degree that warm, oxygenated blood is no longer reaching the far ends of your feet in adequate volume. Here's how I explain it. Think of your circulatory system as a home heating network, with pipes running to every room. Your feet are the rooms at the farthest end of the system. When those pipes narrow from blood vessel damage, the heat simply doesn't travel the full distance. The room stays cold, no matter how hard the furnace runs. That coldness isn't about external temperature, it's about the condition of the pipes. The American Heart Association identifies peripheral artery disease, caused by the narrowing of blood vessels, as affecting over 8 million Americans, with diabetes being the single greatest contributing risk factor. Persistently cold feet are among its earliest and most reliable symptoms. The most effective response is a 30-minute brisk walk every single day. Not a stroll, a purposeful, arm-pumping, cardiovascular walk. This actively forces blood circulation into the feet and lower legs, strengthens the vessel walls over time, and can begin to reverse some of the early narrowing. If 30 minutes feels like too much right now, start with 10. What matters most is that you begin, and that you begin today. This last one is the one almost no one talks about. I have never seen it mentioned in a patient pamphlet. Most people walk past it every single day without noticing it. And honestly, even some physicians miss it. Patients don't bring it up because they simply don't notice it themselves. But during a thorough foot examination, when I look at the tops of the feet and the lower legs, I sometimes observe something striking. No hair. A patient looks down and says, "Huh, I never even noticed that." And that right there is exactly the problem. It's a quiet, easy-to-miss sign, but it matters enormously. Hair follicles require a consistent supply of oxygenated blood to function. When circulation is significantly disrupted by long-standing elevated blood sugar, the follicles in the feet and lower legs are among the first to be affected. They slowly stop receiving what they need. Over months and years, they stop producing hair altogether. That absence of hair is a visible marker of blood vessel damage that has, in many cases, been progressing silently for years. I put it this way. Imagine a garden where the irrigation line has partially blocked. The plants don't die all at once. They just stop growing. They thin out. They go bare. The absence of growth is the garden's way of showing you that something is wrong with the water supply. Your hair follicles are those plants. Their gradual disappearance from your lower legs and feet is your body's way of showing you that something is wrong with the circulation supplying them. Research published in Diabetes, Obesity, and Metabolism found that hair loss on the lower extremities correlates significantly with peripheral vascular disease in diabetic patients, making it a reliable, though frequently overlooked, clinical sign that trained physicians specifically look for during examination. Right after this video ends, look at your lower legs and the tops of your feet. Compare the hair density there to the rest of your leg. If it's significantly thinner than it should be, or absent entirely, schedule a blood glucose test this week. Not this month, this week. At any certified lab, it costs approximately $12. Under Medicare, it's covered for most of you. $12 could change the entire direction of your health. We've covered a great deal today. 9 signs. 9 opportunities to catch something before it quietly steals your quality of life. And I want to be honest with you about something personal. One of the hardest parts of what I do is sitting across from someone, a person who cared deeply about their health, who took their vitamins, who walked the dog every morning, and having to tell them that something has been progressing inside their body for 2 years. Not because they ignored it, not because they were careless, but because they simply never had the information they needed. You now have that information, and here's all I am asking you to do with it. Just one thing. Tonight, before you get into bed, sit down in good light and look at your feet. Give it 30 seconds. Look at the skin. Look between the toes. Press gently and check for numbness. Look for any wound or discoloration that shouldn't be there. 30 seconds. That's it. And if you see or feel anything from this list, please call your doctor tomorrow. Not next week, tomorrow. Because the earlier this is caught, the more completely it can be managed. In most cases, through changes in diet, a daily walk, and an open conversation with your physician. You have worked hard for your life, for your independence, for your ability to do the things that matter to you. Don't let something as manageable as blood sugar quietly take any of that from you. Simply because nobody showed you what to look for. Now you know. If this video was useful to you, share it on Facebook right now. Tag a family member, a close friend, a neighbor. You may be giving someone something they didn't know they needed. And if you want more conversations like this one, I post a new video every week on this channel. Real health topics. The kind of information I discuss with my patients every day that most people never hear outside of a doctor's office. Subscribe and bring someone you care about along with you. I'm Dr. Richard Ben. Stay informed, stay ahead of it, and please, take care of those feet. I'll see you in the next one.